Hi, everyone. My name is Marie Curtis. I'm an occupational therapist. I want to say thank you to Courtney for that introduction before going on the break. I hope everyone got a little movement in and feel rejuvenated and ready to be a part of this conversation now. I'm an occupational therapist. I work full-time for UNC Health, and we have an atypical Parkinsonism clinic there. So I've had the opportunity to get to know a lot of individuals with atypical Parkinsonisms, with PSP, with MSA, with CBS or CBD. And I also have a specialty certification with low vision. And it's one of my favorite topics. So I'm really excited to have this conversation with you today. We are going to go over some typical symptoms that an individual may experience from a visual perspective with atypical Parkinsonism, and then some functional techniques that you can do in your own home. Nothing too high tech or anything like that, just some little day-to-day tricks to help. First, we'll talk about those visual symptoms that you may experience. Not everyone will have these different symptoms, but it's something to keep your eye on and to keep in the conversation when you're working with your healthcare provider. So here's a list of some of the most common symptoms that we may see. Our first one is gaze palsy. So this is difficulty with moving your eyes normally. And we see this a lot with PSP. It's part of one of the symptoms that's pretty common to get the diagnosis. And a lot of times it starts with that downward gaze. So you have trouble with keeping your head still and bringing your eyes down to look at an object and keep it in fixation. And you may start to see it from looking from side to side as well. Another one is that blurred vision. And it's tricky when it comes to blurred vision if it's from the neurological aspect of what the condition of what's going on, or if it's a part of that general aging. I know that I'm getting into my later 30s, starting to get closer to 40, where a lot of times we'll need those reading glasses. And that's more just the lens inside our eyeball and its ability to ball up and stretch out as we accommodate and look at items closer and farther away. So just keeping that in mind, but it's a good thing to keep in mind if things start to look fuzzy or it starts to look out of focus, you want to follow up with your eye doctor and try to determine if this is something that's a part of the disease. Is there a neurological aspect to it, or is it general aging? A lot of times we can use corrective lenses like your glasses or reading glasses to help you to accommodate to that. Another part to think about too with blurred vision is it may be fatigue related. You may notice that it happens more in the morning and it takes a little longer for you to wake up and be ready for the day, or you may notice it more at the end of the day. You may notice it after certain activities, like doing a birthday party with the grandchildren, or going out shopping with friends, or going to a sporting event. You may notice some more blurred vision at that time. And that's where you want to track your activities and the symptoms you experience. And that way you can kind of find that rhyme and reason around it, and it can help you with that planning piece. Our next one is photophobia. So this is a light sensitivity, and it can be uncomfortable to be in bright lights, whether it's inside and it's those fluorescent lights that come down on you, or outside in the natural light in that sunlight. Those are different ways that we can experience uncomfort or even pain from that light sensitivity. Our next one on the list is diplopia. That's just a fancy way of saying double vision. And double vision can appear in different ways. It can be the two objects appear next to each other. It could be they're on top. It could be overlapping. Or for some people, they even experience more of a smearing when they're looking at something. And a lot of times what we experience this is it's due to our eyes, the eye muscles not being able to work together. So just like when you are trying to coordinate your muscles and your legs to stand up to take that step, and maybe difficult also for your eye muscles to coordinate and work together. And that way each eye is taking in a different picture and giving it to your brain. And so that you're appearing to have two images versus that one where your eyes work together and synchronize. Our next one is saccades or saccades. Different people pronounce it different ways. I like to say saccades. And we can experience a slowness in saccades. And that is when you're jumping your eyes from one spot to another. So you're not tracking and following a car driving by where you keep your eye on the car and you watch it go by, or you watch a bird fly across. It's more when you jump your vision from looking at the squirrel that's up in the tree and then jump your eyes to look at the flower that's in the garden. Your eyes are jumping from one fixation to another fixation, or jumping between targets. And when we have a slowed saccade movement, it takes more time to get from one target to the next target. And this can cause some concern for safety, especially when we're thinking about walking around in crowded areas. I think about Walmart right before the holidays, or the mall, and all those different people walking in different directions, and they have their shopping list. So they're not necessarily paying attention to what may be in their path. And so you have to jump your eyes from focusing on one person to the other person while jumping your eyes to looking for certain items. And with that slowness, you could be a little delayed in finding that target. Our next one is difficulty with fixation, or focusing your eyes on a target. One area that we see is the square wave jerks. And that's when you're trying to fixate your eyes and look at that single target, but your eyes just kind of move a little bit in that fixation. And you want to think it's almost like you're watching a candle, or that flame, how it flickers in and out and jumps around a little bit. It's not always predictable where that flame is going to jump to, but that kind of gives you an idea of how the eyes may look when they're trying to fixate on one target. Next, we have an involuntary blinking, or the blepharospasm, and that's where it's challenging to keep our eyes open. We have an excess in blinking, and it's hard to keep something in focus and to have that conversation with someone because of the amount of blinking that we're doing. The other one is the eyelid apraxia. So in contrast, our eyelids close, and it's hard to open them and keep them open. That's also difficult in a social situation, because we want someone to know that we're listening, we're part of the conversation, we're being active, but our eyes are closing and it's hard to keep them open, which can be kind of a signal in a social interaction that someone's falling asleep, which is not necessarily the case. Next, we're going to move into our functional management techniques. So here we're going to talk a little bit about some things that you can do at home, or if you go out to a restaurant or a friend's house, just different little tips and tricks to help with some of these symptoms. So the first one we're going to talk about is that gaze palsy. So just to refresh your memory, that is the difficulty to move our eyes in different directions, or maybe the most common one is that gaze to look down. So to provide a little bit of a demonstration, it may be bringing something up closer to where your eye level is, so you don't have to look down as far. So here, I have small children at home, so I got a cute little kids play here. But I use these building blocks also for my kids. You know, you never know. I had these as a kid, and we're using them again now. And they're really great and kind of helpful to have around. So you can use that to lift up the plate and make it eye level for you. So you don't have to worry about that gaze palsy to see your plate as effectively. Another strategy, and I learned this from a Duke OT recently, and I just thought it was absolutely brilliant. And I'm so excited I get to share this idea with you today. But I don't know if anyone already has a makeup mirror at home where one side is more magnified, the other side is that typical mirror, and then it has a swivel so it can go back and forth. But this Duke OT told me that you could place it, and once you're looking at the mirror where it brings it up to eye level, you can have it angled to see your plate. And that way it also helps with that gaze palsy and you can see what you're doing there. You can use this for other activities as well. Probably not reading because the mirrored image would be backwards, but some other activities as well to make it, to bring it up so that you can see it, you can appreciate it, and maybe looking at flowers or maybe looking at artwork or something to appreciate. Another thing is to think about tilting your head. So if you're having trouble bringing your eyes down, focusing on having that range of motion so that you can angle your head to see down or in the different directions. I know that neck control can be challenging for a lot of us, especially with that atypical Parkinsonism, and seeing if there's any other ways to help with that as well. But that could be one strategy to help. Another thing to think about is if you're doing a task you normally stand up to do, like it may be you really enjoy making brownies or you enjoy chopping the carrots for the salad, instead of standing at the counter where you have to look down, you could also have something to sit on, and that way there's not as much of a gaze shift when you look down at what you're doing. The next slide we're going to talk about is light sensitivity. This is a pretty common one, and a lot of times it is related to that neurological change. There have been a lot of products come out in the last couple of years that have been pretty helpful. Having glasses with a tint can be helpful. A lot of times people start with their sunglasses, what you wear outside or maybe what you wear on the beach, and wearing those inside when you're especially in fluorescent lighting to help. So this can be a good strategy. Also, the picture on the slide has more of a blue light sensor, so a little bit of a blue tint to the glasses. A lot of people will use this for computer screens as well. And then also, because of esports, video gamers, there's a lot of competitions with video games, and they do have a lot more funding. So they are doing a lot more research, and they have found different glasses, maybe more of an amber color or a yellow color, that helps with that blue light screen and help with some of that light that tends to create headaches or dry eye or that eye fatigue, and help limit that. So the good thing about that is those products trickle down to the rest of us, and you can find them on Amazon or anywhere, and they're not quite as expensive either. So looking at different glasses, different kinds of tints, some people even find a rose color or a red can be helpful to help with some of those lights. Another thing could be if you have big windows at home, you have a lot of sunlight that comes in, then having a certain kind of curtain over the window can be helpful. And we're thinking of it as a way to filter that sunlight. So certain rooms may be a little too bright, but having that semi-sheer curtain could help to filter some of that sunlight. The next tip we have here is planning for known bright areas. And I always think about the grocery store. And especially with the holidays coming up, we're thinking about how busy they are. And if you could know where the different products are, you have your planned route of what aisles you're going to go to, what areas you need to look in, then it's going to be more direct and less time you have to be in that brightly lit area. And it may be you wear your glasses for that, you wear a brimmed hat, to block out some of that, excess lighting from the fluorescent lights. And that way it may limit some of that visual fatigue or some of that headache or something like that that some people are experiencing. The last one we have here is thinking about our electronic devices. And we can adjust the screens to fit our needs. So you can have different strategies for that. You can use light mode or the dark mode or nighttime mode. And that just decreases some of it, makes it a little more filtered and not as bright for some individuals. You can also invert your screens. And so instead of having the white background, you can have a black background. And I just noticed on the iPhone that they have the classic invert versus now the smart invert. So in 2020, I was treating a lot of children as well, still in the outpatient clinic. And a lot of kids were basically doing school at home. It was a lot on the computer. That's a lot for a kindergartner to do. And our caseload for kids coming in, because they weren't having that hands-on-hand interaction for handwriting, or they're having all these visual issues, they're having more headaches or dry eye because of all the screen use, we were treating kids in our clinic. I would have some of the kids bring in their computers from school, and one child, we figured out how to invert his screen. And that was great until they had a video meeting and all of his classmates, his teacher, everyone was green. This poor child was so scared. And the mom called me and was like, hey, that's not going to work, because all his classmates that he's never met in person now look green and it's scaring him. So we had to go back to the classic mode or back to the regular mode. So I'm happy to see that Apple, at least so far, has come up with the smart invert. And how it describes it is, if you're looking at this PowerPoint, it would make the white background black and all the white writing, or all the black writing in white. So it inverts it, it switches it, but it wouldn't make me green. It would leave me as my normal coloring so that it wouldn't be so scary. So it took them a couple of years, but they got that fixed. So I'm happy to see that. And that's something that you can do as well. Some people really enjoy that. They feel that it helps with that light sensitivity, especially on a screen. Just some things to keep in mind. Okay, we're going to talk about one activity that a lot of people really enjoy doing, and some of these visual symptoms can really impact, and that's reading. Reading is important for us to do, especially with managing our health. We need to be able to read our medication labels, as well as print out the instructions on how to take our medications and when to take them. But also whenever you see your medical provider and they send you home with some of the paperwork. So those are some basic literary concerns that we have. But then also a lot of people enjoy reading for pleasure as well. So we'll talk a little bit about both. So step one, and we're thinking a lot about that down gaze can be challenging for reading. So thinking about ways that we can bring up the materials so that you don't have to do that down gaze, or maybe that blurred of that double vision, using the certain glasses that may be helpful, that's prescribed to you by your optometrist or ophthalmologist. And then also thinking about possibly increasing the font size. A lot of times we will start with size 14 font and using Arial font, and that tends to increase the legibility of written materials for people. So this is something you can ask your healthcare provider is to have a larger font for the information they send home to you. And your library, they may have large font books for you to read. They'll have like a low vision section as well. There are there's different libraries from the from the federal government, where you can loan books as well, and they'll mail it to you for that. Or also using our screen, so using our electronic devices to help. We're also thinking about the slowed saccades. So that again is your eyes jumping from one place to another and not that smooth tracking or smooth pursuit. So when we're thinking about reading, we're jumping from the word to the next word. We don't actually stop on words like the or and. Our brain fills it in. So we go from one word to the next word that we need to read to fill it in to get that flow. And then once you get to the end of the line, that jump from the right side of the page all the way back to the left and down a line. So that is a very precise movement. And with that slowed saccades, a lot of times we can get lost in that jump. So thinking about ways to keep it online, and it may be adding a piece of paper to cover up a little bit on each line, and then you bring it down line by line can be helpful, or having something bright on the left side of the page so that your eyes can jump back over there. Another thing to think about is high contrast. So here we're thinking, a good example actually on this slide is we have task of reading, and it is in Carolina blue on white. And that's a perfect example of what not to do. So that light blue on that white isn't a good contrast, and it's making our eyes work a little bit harder, which makes our visual processing system work a little bit harder to see it. That black and white, that high contrast tends to be best. And as we build on with the contrast, I do want to demonstrate for you when it comes to food, how we can think about that contrast. Here I have a blue bowl and I have a blueberry, and you can see that there's not a lot of great contrast. You may find them, you can use your fingers to fill them and get the different blueberries out, but we're making our brain work harder for this task that could be more simple. And what we can do to make it more simple is to swap it out for a contrast plate. So here I have yellow. So I have the blueberry on the yellow plate, and you'll see it's much easier to see here than the blueberry on the blue bowl. Another example of this could be filling up a clear glass with water. It can be pretty challenging to see when you get to the top. And so we think about ways to add on that contrast. Again, I'm using my kids' toys. I think it's part of construction. I don't know, but it's just a little orange plastic piece that is full of air, so it floats nicely. A lot of times we will use the reusable ice cubes. And the good thing about those is they're easy to clean, and you can sanitize them and use them time and time again. So what you'll see is that we have this clear glass, and as we pour in the water, it floats to the top so that we have an idea of where it stops and where we can stop pouring. So that way it helps with that contrast, because otherwise it's pretty hard to see where that water is in the glass. The next point we have, so that was kind of our tangent off to the side about contrast, but coming back to reading, we're going to think about high contrast, or sorry, we already did high contrast. We're going to the next one. Avoid divided words. And that's where we're thinking of written material that may have two different columns, and to fit it into the nice, pretty columns, they'll divide words and put a dash there where it goes on to the next line. A lot of times we see this in religious writing. And so thinking about the Bible, for an example, it'll have those two columns and it may divide those words. And when it comes to that slowed saccades and that double vision, it can be really challenging and take longer to see what that full word is. So we want to think about ways to make the material more readable so that you can really digest the information and focus on, if it's religious material, maybe the meaning for what you're looking at it for, and not so much on the task of actually reading. So this kind of goes into our next point, where we can listen while reading. You can have a podcast playing while you're also reading the manuscript for it, Or you could also have a book and the Audible book as well, and listening to those together. The same thing for your religious readings as well. But thinking about ways that we're getting that auditory input with the visual input, and then that way you can really focus on the context of it. So this is more for our care partners and our caregivers, our families and friends, but we're going to talk about observations to look for discomfort. So we're keeping an eye on our loved ones when we're out and about and seeing if anything, any visual stimulation is causing discomfort. So it might not be that you get the verbal communication about it, and we're looking for those nonverbal cues. So it may be the individual is keeping their eyes closed, and it's not because of the eyelid apraxia, but more because the lights are too bright or there's just too much to look at. So we keep those eyes closed. And you may see just a look of frowning or unhappiness, or that squinting, trying to see something and just trying to narrow in on that. That can be a good indicator as well. Another one is that dry eye or the eye fatigue from keeping our eyes open and trying to focus. Maybe it's that double vision or that diplopia, and how do we get it to focus? And we're working very hard, but it causes a lot of fatigue, so we tend to rub our eyes. And lastly, we may have complaints of head pain or headaches. That's a pretty common symptom of overexerting our visual system. And it may not be in the moment that we experience the head pain, but later on that day or even the next day. So if you do tend to see headaches or this routine of headaches, thinking about what activities have we done, what can we modify or change so that we decrease the maladaptive response or the head pain experience. All right, and our last screen, of course, as an occupational therapist, I have to bring up fall prevention and ways to keep us all safe. And we're going to think about what we can do to prevent falls. And this is a pretty common safety concern for a lot of our individuals with atypical Parkinsonism, and something that we talk about a lot as healthcare providers. So the first thing is to take a beat. If you're seated and you're about to get up to go do something, take a minute and scan the environment and look around and see, okay, I see there's a chair over there, there's a person over there, and I'm walking to the bathroom here. Plan that route and make sure you don't have any obstacles in the way, or you have a plan to get around the obstacles before you get up, and take a moment before you start that first step. The next one is definitely going more to those individuals who may have some young children in their lives, or teenagers, or someone they live with who likes to leave their shoes out, or the dog or the cat that leaves their toys out. But thinking about ways to keep that clutter off the floor. We want to avoid any possible tripping hazard. And for some, that may involve the carpet as well, or a rug, but making sure that it's not going to increase any potential fall risk. It also can sometimes relate to small furniture, maybe that beautiful antique side table. Maybe we find another place for it where it can be safe for the table as well as the individual walking around, and remove any possible fall hazards. The next point we have is slow and steady movements. So we want to think about, how do we take our time? We want to think about having good quality steps or good quality planning as we maneuver the wheelchair, or take our steps with our upright walker or with our rollator, and making sure that we're in control of our movements to avoid any falls. And then the last point I have on this slide is to keep furniture layout the same. You may have a family member who likes to mix it up and change up the room and the way it looks, but we really want to keep furniture in the same spots so that it's predictable. And we're also really thinking about at nighttime. So in the middle of the night, someone may get the urge to get up and get a drink of water, or they may need to go to the bathroom, which is pretty common for a lot of us. And so we want to think about keeping the furniture in a predictable spot and having appropriate night lights to help. Having the night light in the bathroom, having the night light in the kitchen to help. It could also be adding a flashlight to whatever walking device that you may be using in the middle of the night. Or you can even get motion detector lights and putting them under the bed just where your feet would go down. So when you put your feet down, the light comes on and you can see your feet. And take that time before you get up, standing, making sure you're feeling okay before you take that first slow and steady step. All right. So that wraps up what I was planning to present about today. And I think Courtney's going to come on and help us with questions.
Good job. Great. Thank you so much, Marie. That was really insightful. I'm taking my own notes and recommendations for people. That was super insightful. We do have a few questions from the chat and then additionally some from registration. So we'll just jump in. The first is, why is it difficult to focus when going from bright to dark areas? So thinking of like driving into a parking garage or vice versa.
Absolutely. So that is our eyes switching. And that part of it is general aging as well. And then some people are just born with a natural ability to accommodate better than others. But we also have a muscle that's around our lens and our pupil of our eye. So the iris. So the iris constricts when it is brighter light. So we don't need to take in quite as much information at the time because it's bright. And then it opens up as it's darker so we can let in as much light as possible. So it's part of this autonomic response, which is without us thinking or trying, our muscles will respond to accommodate. So part of our brain is controlling that process. And just in general, as we get older, we tend to respond a little bit slower, but also it could be part of the neurological component too. And with this disease, that can change as well. The best thing to do is just give your body time, understanding that it is a process and we just need to give it a beat. So that's slow and steady. Going into the driving into the parking garage, understanding it's going to take a minute or two, making sure you're not going to be in a dangerous spot for anyone as your eyes adjust.
That leads me to the next question, which is, how can people sort of differentiate eye issues due to aging and general aging or progression of symptoms? Is there kind of a trick or a help you can offer?
That is a really good question. And when we do our clinics, we have a team meeting afterwards. And I feel like almost every time it comes up, like, do we think this is general aging or do we think this is part of the disease? And we can have our opinions, and you can have your own opinions about what you're experiencing. I don't think that we ever know for sure. I think talking to your eye doctor about it is a good place to start. Especially if you have an ophthalmologist, uh, a neuro-ophthalmologist is going to really be able to look at the MRI as well, and let you know if there's any neurological changes that would be causing it. But I don't know if it necessarily changes what you would do. So thinking about, we treat the symptoms of it. So if if you need glasses to see more clearly because everything's fuzzy, I don't know if it matters if it's from the progressive disease or if it's from aging. They're still going to treat it the same way. It may be different when it comes to diplopia or that double vision or the palsy as well. But just kind of keeping those pieces in mind and just working with your healthcare provider that knows your case, and y'all can try to problem solve it as best as you can.
Got it. I'm trying to form my next question that just came to mind, but is there a recommendation to see a neuro-ophthalmologist about these, or could you just see your typical ophthalmologist? I know that neuro-ophthalmologists aren't always super accessible for people because they're a little bit rarer.
Absolutely. Just to give you a little background on what neuro-ophthalmology is. So an ophthalmologist and a neurologist both go to medical school. So they do that 4-year degree. They do their residency, which a lot of times is another 4 years. And then an ophthalmologist can practice right there. To become a neuro-ophthalmologist, they either went to a neurology residency or ophthalmology residency, and then they do a fellowship in neuro-ophthalmology. So they're really focusing on these neurological conditions and how it can affect our visual processing. So the neuro-ophthalmologist isn't going to focus on your eyeball. The ophthalmologist is going to focus on your eyeball. The neuro-ophthalmologist is going to focus on the visual processing piece. That helps.
Yeah, actually, a question just came into the chat kind of related to this. That's a good segue. Their husband has PSP and he often complains that he can't see very well and that everything looks blurry. They visited an ophthalmologist who were told that he has 20/20 vision. Do you have any familiarity with this or recommendations?
Yes. So that means his eyeball looks great. So his acuity looks well, he's accommodating well. It's more the visual processing piece. So for him, if he doesn't necessarily have a need for glasses, it may be that he is having trouble with the eye teaming. And so just like, with PSP, we may have different kind of movement patterns with our body. It changes our gait pattern. We stand up from a chair differently. It's the same thing with our eyes too. So those muscles are affected as well. So your eyes might not be teaming, or your husband's eyes might not be teaming up quite as well. And so a neuro-ophthalmologist could be good to help with explaining that and looking into it more. And then finding either an occupational therapist or a vision therapist, depending on where you live. Each state's a little different and each area is different with how they practice, to help you with compensating and problem solving around it could be helpful.
Makes a lot of sense. And then the last question we have, folks, please feel free to keep asking questions in the chat and I'll see if I can think of any too. But the last one I have for now is, are there any specific depth perception issues with these diagnoses that you see, or just in general, I guess,
Yeah, absolutely. And part of that is part of the aging process, and part of it is the neurological progressive disease aspect. And it is very common, and stairs make me very nervous because if you fall on stairs, you are more likely to get hurt than if you just fall on even surface. And a lot of times, because we do need reading glasses as we get older, people will get bifocals. And the trick with bifocals is your brain has to learn how to process that. And so it's a trial and error, and it takes time. It takes time to accommodate that. So we are very hesitant about people getting bifocals after they have a diagnosis that's a neurological diagnosis, because it's going to be harder on your brain to adjust and get used to that. But basically, it makes everything look up close. So when you go to the steps, you're about to walk down the steps, everything looks closer. It can really mislead what your body's going to do to accommodate to that. For that depth perception, it's also a bit of the accommodation. So we're thinking about the lens that's inside your eyes. I feel like people are more comfortable with cataracts and understanding with a cataract surgery, they take out your lens and they put in a new lens for you. But just like our joints, as we get older, they get a little stiffer. They're not quite as flexible. The same with the lens in our eye. So with accommodation, it balls up, and then to see things up close, and then it stretches out as we see things further away. So, and then the other piece is using both eyes together. So it's teaming. So both eyes have to look at the same target. And then with that balance with the accommodation and the eye teaming, that's how we determine how far and how close different items are. So if we're having trouble with depth perception, we definitely want to make sure we use those tactile cues as well. So we definitely want to use any handrail, getting on and off the toilet. We want to be mindful that we have a good tactile input. We know where that toilet is because we don't want anyone to accidentally miss it and get stuck between a toilet and the wall, or again with the steps. As one of my curbs, getting out of the car, stepping up on that curb is also a big fall safety concern.
Speaking on safety concerns, do you have any suggestions or warnings about walkers or other walking aids?
Yes. Well, and that's where you definitely want to work with either your physical therapist or your occupational therapist to make sure you have the best walking device for you. And I would be open to it when they suggest something more advanced earlier on, when you're like, I'm still up and I'm walking and I'm getting to my activities well. And just being mindful that they may go ahead and suggest using a wheelchair or going ahead to get that custom fit wheelchair. With the way our company does insurance and vending and getting items paid for and getting them, it can take a while. And it kind of depends where you are too. Where I live, it can take average about 6 months to get that custom wheelchair. And so we definitely hear a lot of pushback, like, I don't need that yet, but sometimes it's good to go ahead and get the ball rolling for that. So thinking about the rollator too. The rollator is nice because it has 4 wheels and it has a seat. And it can go a little faster. It can take the curves a little bit easier. But a lot of times we'll see the rollator gets ahead of us and we're playing catch up. So we have that forward posture. It's going to keep going if you lose your balance and you're going to go down. And so the walker will have 2 wheels and 2 tennis balls, right? A lot of times we put the tennis balls on there. And that way it goes a little bit slower. It also is a little slower for those turns. And that's where you get that slow and steady walking gait. There's other devices like the U-Step is one company. I don't know if there's another company that does something similar. But what I like about the U-Step, they have the upright. And so instead of like the rollator where you have your arms down, you're going forward, it supports your forearm. So you have a more upright posture and you can keep the device closer to you. The other nice thing is that you have to squeeze it for it to unlock. So when you let it go, it locks it and then you squeeze it to unlock. Because a lot of times we forget to use our brakes when we're stopping to sit down or we need to just stand static and we think it is static, but the brakes are off.
Great. And that honestly sets us up well because tomorrow we're having a conversation about wheelchair evaluations. So thank you for setting that up perfectly. That's all the time we have for questions right now. But Marie, thank you. This was super insightful, and we really appreciate you taking the time today. It's great.